Pancreatitis is a swelling or inflammation of the pancreas. This may happen when the digestive juices or enzymes attack the pancreas. So for those who don't know the pancreas, it's an organ that lies behind your stomach on the left side of your belly. So it's close to the first part of your small intestines, I mean the duodenum. So the pancreas is a gland that does two main functions. Number one, it makes your enzymes and sends them into your small intestines. These enzymes help break down food. Number two, it makes the hormones insulin and glucagon and sends them into your bloodstream. So these hormones control your body's blood sugar levels. So pancreatitis may be acute or chronic. So acute pancreatitis is a sudden inflammation. It lasts for a short period of time. So it lets the pancreas return to normal afterward. But repeated attacks of acute pancreatitis can lead to chronic pancreatitis. So this may cause serious problems. Whereas chronic pancreatitis is a long-lasting inflammation that comes and goes over time. So it causes permanent scarring of the pancreatic tissue and may cause the pancreas to stop making enzymes and insulin in severe cases. Causes of pancreatitis. So the most common causes of pancreatitis include alcohol abuse, and number two, you can talk about lumps of solid materials, I mean the gallstones, which are found in the gallbladder. So gallstones block the pancreatic duct, so the enzymes can't get out of the pancreas. So other causes of pancreatitis include belly injury or surgery, high levels of fat particles, I mean the triglycerides in blood, very high levels of calcium in the blood, certain medicines such as estrogen, steroids, and thiazide diuretics. So we can also talk about the infections such as mumps, hepatitis A or hepatitis B. We can also talk about cystic fibrosis, tumors, certain genetic defects, congenital abnormalities in the pancreas, trauma to the pancreas, and cigarette smoking. Symptoms of pancreatitis. So symptoms vary person to person. Number one, severe belly pain that spreads to your back or chest. So it may feel worse after eating. Number two, nausea and vomiting. Number three, rapid heart rate. Number four, fever. Number five, swelling and tenderness in your upper belly. Number six, fluid buildup in your belly. Number seven, lowered blood pressure. Number eight, jaundice, I mean that yellowing of the skin and eyes. So symptoms of pancreatitis may look like those of other health problems, so you should go to hospital and see your doctor. So how do we diagnose pancreatitis? Number one, we can diagnose pancreatitis through abdominal x-rays. So these make images of the internal tissues, bones, and organs. Number two, we can use ultrasound. So this uses sound waves to see the organs of the belly. Number three, we can use an endoscopic ultrasound. So this is an internal type of ultrasound done through a flexible tube. I mean that endoscope, which is inserted into your mouth while you are sleeping. Number four, you can also use endoscopic retrograde cholangiopancreatography. So this finds and treats problems in your liver, gallbladder, bile ducts, and pancreas. So it uses x-rays and a long flexible tube with a light and a camera at the end. That's called an endoscope. So the tube is put in your mouth and throat. Then it goes down into your esophagus. So through your stomach and then into the first part of your small intestines, I mean the duodenum. So then dye is put into your bile ducts through the tube. The dye lets the bile ducts be seen clearly on x-rays. Number five, we can also use CT scans. So these are imaging tests that show details x-ray images of part of the body such as the bones, muscles, fats, and organs. So CT scans are more detailed than regular x-rays. Number six, you can also use magnetic resonance cholangiopancreatography. So this uses MRI to make detailed images of the pancreas, gallbladder, and the bile ducts. So this test is often done with a standard MRI whereby a contrast dye is used to see your image. So today we're going to talk about how pancreatitis is treated. Number one, surgery to remove gallstones or your gallbladder. So this is done if gallstones or your gallbladder are causing pancreatitis. Number two, using a nasogastric tube. So a nasogastric tube is a thin tube passed down your nose into your stomach. So this tube can be used for a few weeks when vomiting is a problem. So it can be used to remove fluid and air and give your pancreas more time to heal. You Can also be used to put liquid food into your stomach as you heal. Number 3, endoscopic retrograde cholangiopancreatography. So this is used to find and treat problems in your liver, gallbladder, bile ducts, and pancreas. So it uses an X-ray and a long, flexible, lighted tubes called an endoscope. The tube is put into your mouth and throat, then it goes down your esophagus, into your stomach, and then into the duodenum, the small intestines. So then a dye is injected into the ducts through the tube. So the dye lets the bile ducts to be seen clearly on X-rays. The tube has tools in it here, so these tools can remove fluid and blockages and also can take out gallstones. These are the things which you can do if you have chronic pancreatitis. Number 1, you have to stop drinking alcohol if it's the one which caused the pancreatitis. Number 2, you have to stop smoking. Number 3, you need to get enzyme supplements to help digest your food. Number 4, you need to get insulin if you get diabetes. Number 5, you need to eat small, high-protein, low-fat meals. Number 6, you need surgery to remove the permanently damaged part of the pancreas. Prevention of pancreatitis. Number 1, avoid alcohol abuse. So excessive alcohol consumption is a major cause of pancreatitis. So limiting or avoiding alcohol consumption can significantly reduce the risk of pancreatitis. Number 2, maintaining a healthy diet. So this involves eating a low-fat diet to prevent gallstones, which are a leading cause of pancreatitis. So this also involves intake of fruits, vegetables, and whole grain. So you should also avoid processed and fried foods. Number 3, you should stay hydrated. So drink plenty of water to support digestion and also to prevent gallstone formation. Number 4, maintaining a healthy weight. So obesity increases the risk of gallstones and pancreatitis. So you should do regular exercises and you should also eat a balanced diet. Number 5, control cholesterol and triglycerides levels. So high triglycerides can trigger pancreatitis. So you should eat healthy fats which include nuts, fish, olive oil, and avoid trans fats. Number 6, you should quit smoking. So smoking increases the risk of chronic pancreatitis and pancreatic cancer. Number 7, you should manage underlying conditions. So these underlying conditions include gallstones. So if you have gallbladder diseases, consult a doctor about management and removal. So we should also talk about diabetes. So if you have diabetes, keep your blood sugar levels low and under control. So we should also do some medication awareness. So there is medication that can cause pancreatitis. So always check with your doctor if you're going to take some medication. Thank you very much. I'm Mujib. Please like my video, share, and follow me up.